Welcome back. I'm Brent Meredith, and we're finishing our special men's health episode tonight with Nashville urologist Dr. Matthew Pollard. So, Matthew, I had to cut you off in your answer before the break about the wave treatment for ED, and I'm curious, I'd like for you to be able to have some time to finish that up because it is something new, even to me. I've not heard of this treatment.
Yeah, so it's a low intensity shock wave that we apply to the part of the penis that gets erect when you get an erection. And for men with more mild symptoms, it can help sort of improve your ED symptoms. Now, it's not for everyone, and it's not for men who have even moderate or severe ED. So I was mentioning, it's important to talk to your doctor about whether you're a good candidate for that before seeking that treatment. If you're going to another clinic to get it or another provider, it's important to talk to your doctor about it before spending the money on it.
Very fair enough. You don't want to go down a road for treatment that's not for you. And you had mentioned sort of the advertisements for that. I have seen, and this is going to kind of a lead into my next question, the advertisements for medicine to sort of help with curvature, which kind of lends me to think about Peyronie's disease. And I was curious, is that what we're seeing now, or commercials for that? And kind of explain a little bit about how that can come to be and the treatment for that.
Absolutely. So yes, I feel like we finally removed some of the stigma around Peyronie's disease. It's actually up to 5 to 10% of men at some point in their life will develop some Peyronie's disease and potentially some penile curvature. Now, Peyronie's disease and penile curvature that's acquired or that develops throughout your life is very different than curvature that you have since you were born. So there's a whole spectrum of sizes and angles of normal penile erections. But if men develop a bump or a lump or a curve throughout their life, that is something that we classify as Peyronie's disease. And the way that can happen is what's called microtrauma to the penis. So as we live our lives and engage in sexual activity, there may be some bending or some microtrauma that men don't even recognize. Just in the act of having sex or participating in sexual activity, sometimes the penis can get bent to a bizarre way or doesn't even necessarily cause any pain at that time. But over our lifetime, the accumulation of those small traumas can ultimately cause an inflammatory process or more like a scar formation in the part of the penis that gets erect when you get an erection.
Interesting. Okay, so it is something that can just sort of develop over time, as you say, and I think that's great that you made that distinction between being born with a certain shape and versus transitioning or noticing a different shape over time. And sort of
Absolutely.
On the topic of shape and size, if I might make that transition, I know you guys also offer implants, and those are for various reasons and for treatments. How in fact that to me personally feels you kind of get that twinge when you think about surgery in that area,
Yep.
But maybe explain tonight to folks how important that can be for treatment.
Absolutely. So for men with moderate to severe erectile dysfunction who are no longer responding to medications, it can be incredibly frustrating and it can be embarrassing, and men oftentimes at that point avoid engaging in sexual activity and sort of neglect the sexual side of their lives. So what the penile implant does is it truly is the only cure that we have for erection, or for erectile dysfunction. So all the implant does is, instead of using your blood flow to give you an erection, we're using a device that fills with salt water to simulate your natural erection. So it's a quick outpatient procedure that takes about 45 minutes. You're in the operating room, you're fully asleep, and you go home the same day. We basically implant a silicone-based device that, when you want an erection, is able to be filled with water, and basically is identical to the natural erection that you get. Now, common misconceptions about the implant: it does not do anything as far as changing the size or appearance of your penis. It's solely a functional device, and the goal is just to give you a similar erection to what you used to get. The other thing is, it doesn't change sensation, doesn't change your orgasm, and doesn't change the way that you ejaculate. So the way that you experience sex will be the same before and after the implant. The only difference is you'll be able to get an erection like you used to get with the implant in place.
No, that's very fascinating, and I thank you for mentioning, that the sensations, everything stayed the same. I was curious about that myself, how that sort of all played in together. And I know we've got about 3 minutes left, and this is another topic I want to make sure we touched on, because having had someone in my immediate family have prostate cancer, and that's sort of been on my radar ever since, and enlarged prostates are sort of a very common thing. Could you touch on a little bit about how, what are those sort of signs and symptoms, and when you should sort of start screening yourself or paying attention to those sorts of things, especially if you have a family history?
Absolutely. So one common misconception is that big prostates are the same as prostate cancer. So they're very different. A big prostate does not necessarily mean you will have any issues with prostate cancer, and vice versa. If you have prostate cancer, it doesn't necessarily mean that your prostate is anything but normal size. So prostate cancer screening should start around 50 unless you have a family history. If you have a family history, screening should start 5 to 10 years beforehand. And screening for prostate cancer consists of a simple blood test. So it's a blood test that we call PSA, which stands for prostate specific antigen. And like I said, it's just a simple blood test, and we have a normal range of values for men. And the way that screening works is usually we have to follow a trend of your PSA over your lifetime to really figure out if there's a problem or not. As long as the levels are within the normal range and aren't going up or down significantly, usually that means there's not really any concern for prostate cancer going. Now, like I mentioned, that's a little different than enlarged prostates. And enlarged prostates are something that cause symptoms. Prostate cancer typically does not have any symptoms, which is why we use a blood test to screen for it. But when men come in with urinary symptoms like their urinary stream is slowing down, or they're having to strain or pushing to go to the bathroom, they're getting up a lot at night, or they feel like they're not emptying their bladder completely, those can be symptoms of an enlarged prostate, which is treated a completely different way.
Interesting. No, thank you for making that distinction, and that wrapped up just in time, because we've got about 30 seconds left, and I want to make sure that anyone watching tonight, if they wanted to come take a visit or see you.
So anybody who wants to come see me, I would love to see you in my office. You can either go to our website, naturalmenshealth.com, or you can call 629-219-9595 and request an appointment. We take all major insurances, and I would love to see you in the office.
Listen, thank you very much. We're out of time. Great answer. I appreciate that briefness, but we are completely out of time. I could talk to you for another hour, but you can always follow us on your favorite social channels for local news and entertainment, and watch show clips anytime at outandaboutoday.com. Thanks for watching tonight. Good evening.